The Preschool Language Scale, 4th edition. Purpose. The PLS4 is an individually administered test to identify children who have a language disorder or delay. It is comprised of 2 subscales, auditory comprehension and expressive communication. Pictured here are the materials found in the PLS4. Seen is an examiner's manual, picture manual, 15 record forms, and 23 manipulatives. Case history. Olivia is 3 years, 10 months old. She comes from a stable home environment with a stay-at-home mom. There is no family history of speech-language disorders. At 2 years of age, she had several ear infections. She presents with mostly 1 word or 2 to 3 word utterances. She's been getting frustrated with her inability to communicate, causing behavioral problems. Olivia has been referred for an assessment because her mother speculates that she may present with an expressive language delay. This is the auditory comprehension portion of the test.
Olivia, can you give me just 1 block? Thank you. Put some blocks here. I'll put these blocks right here. Now, can you put all of the blocks in the box? Now look at these pictures. Show me the one that says, "She is on the stairs." Now show me, "He is in the pool." Good job. Look at the babies. Show me the baby who is not crying. Good job. Look at the chickens in the nest. Show me the nest with no eggs. Now look at all the toys. Which toys are not in the basket? Great job.
This is an example of the expressive communication portion of the PLS4.
Can you tell me about your pets?
I have 1 cat and a dog and a fish. The fish is boring, but I get to feed him. The dog smells, but the cat's my favorite. He's Finny.
Very nice. Can you tell me what these things are?
Teddy bear.
Do you know what that's called?
Mm-mm.
That's okay.
Carrot. Banana. Spoon. Horse. Monkey.
I have a pencil. What can I do with the pencil?
Draw.
Good job. Can you tell me what you do with this?
Eat.
This is a jacket. What do you do with the jacket?
You wear it.
And this is a towel. What can you do with a towel?
You dry off.
Look at the little chicks. Can you count them? How many are there?
Lots.
This is the boy's cat. Whose cat is this?
It's the girls.
This is the dog's food. Whose food is this?
It's the cat's.
Good job. What would you do if you were hungry? Look at this.
Eat.
Her hands are dirty. What would you do if your hands were dirty?
Wash them.
She is sleepy. What would you do if you were sleepy?
Nap.
She is cold. What would you do if you were cold?
Tell Mommy.
The bear is running fast. Woo, it sure is hot. How do you think the bear feels? The bear must be very
Tired.
The bear wants something to drink. He must be very
Want water.
The bear wants something to eat. He hasn't had dinner. How do you think the bear feels?
Hungry.
The bear is ready to lie down. He's ready to sleep. He must be very
Sleepy.
But the bear can't sleep. Brrr! He needs a blanket. He must be very
Cold.
Show me your hand. My hand is big. Your hand is
Small.
Let's do some more. Ice cream is cold. A fire is
Hot.
You're awake during the day. You're asleep during the
Night.
What should you do if you can't find your shoe in the morning? What should you do if you feel sick?
Tell Mommy. Supplemental measures in the PLS4. They are the PLS4 profile, in which the clinician draws a line across the profile at the child's chronological age and circles the tasks that the child fails. The language sample checklist, in which the clinician checks all the descriptors that apply to language which the child produced spontaneously during testing. And the articulation screener, in which the clinician says, "We're going to play a game now. Say these words. Say." The clinician says the set of words that corresponds with the client's age. The first of the supplemental tests shown here is the PLS4 profile, in which the clinician draws a line across the profile at the child's chronological age and circles the tasks where the child showed a deficit. This can be useful in determining specific areas to work on in therapy if necessary. This is the language sample checklist, in which the clinician checks off all the descriptors that the child produced spontaneously during testing. An interesting thing about the checklist is that the parent or caregiver can account for anything on the list that wasn't produced during the session, and the child will get credit. For example, if the child does not produce any pronouns, but the caregiver says they've seen them produced, the child will receive credit. Seen here is a picture of the articulation screener sheet. As mentioned before, the articulation screener is a supplementary test in which the clinician says, "We're going to play a word game now. Say these words. Say." The clinician then says the set of words that corresponds with the client's age. The articulation screener is designed for children ages 2 years, 6 months through 6 years, 11 months. It yields age-appropriate cut scores that a clinician can use to determine if further articulation testing is warranted. How to score the PLS4, Auditory Comprehension and Expressive Communication Subscales. The scoring portion for the PLS4 is a little tricky, so it's worth taking a very close look at. First, we look in the examiner's manual to find the start point for the client depending on their age. This is where we start for the Auditory Comprehension and the Expressive Communication Subscales. Each question is marked with a 1 or a 0, which means that the task was either complete or incomplete. The PLS4 begins at the basal point, which is after 3 consecutive scores of 1. The ceiling is when the child has scored a 0 in 7 consecutive tasks. After the test is administered, reaching the ceiling, we begin to score. To compute the raw score, record the number of the last numbered task administered for each subscale. Then subtract the number of 0 scores from this number, and that difference is the subscale raw score. Then the clinician takes the numbers from the raw score calculation and records these scores on the score sheet. Then Table A17 in the examiner's manual is used to convert the sum of the auditory comprehension and expressive communication standard scores to the total language score. As we did before, use Appendix A in the examiner's manual to find the norm referenced scores. This time we use the table to find the standard scores and percentile ranks, the confidence band, and the age equivalents for the total language score. Record these figures on the score sheet. Lastly, record the scores on the score graph, enabling the scoring individual to visually compare the child's PLS4 auditory comprehension and expressive communication standard scores.